How will COVID-19 redefine what the European Union is all about? Hello, everyone. For France 24, I'm François Picard in Paris.
And I'm Melinda Crane for Deutsche Welle in Berlin. In the European Union, healthcare has always been handled at the national level. So, as the corona pandemic swept the continent, it was nation states that were calling the shots. Even between close EU neighbors, borders were closed, crucial medical exports were stopped, and solidarity was looking pretty illusory. But that is now changing, with French patients, for example, being treated in German hospitals.
Yeah, and Melinda, with a crisis that we're 2 months into, which some are calling the biggest test for this continent since World War II, a lot of questions going forward. The French President Emmanuel Macron calling it a moment of truth ahead of Thursday's virtual summit. There are those that are eyeing deconfinement, and then other nations that are doubling down. What common response can France and Germany, often dubbed the motor of European unity, rally a continent that's sure to face some major, major challenges, both within the European Union and from the rest of the world?
Our title today is Corona Europe's Moment of Truth. France 24 and Deutsche Welle TV join up for the debate. Welcome.
And joining us from Frankfurt, he's the former deputy mayor there, former student leader of May 68, and former co-leader of the Green Party in the European Parliament. Thank you so much, Daniel Cohn-Bendit, for being with us.
Hi.
And joining us from his Berlin office is Matan von Marschall. He's a member of the German Bundestag representing Freiburg, which lies close to the French border. And he's also a member of the Franco-German Parliamentary Assembly. Welcome.
Thank you.
From Strasbourg on the banks of the Rhine, we are pleased to welcome Dr. Siamak Agababaye. Doctor, you're an emergency physician and also member of the Municipal Council in Strasbourg. Thank you for being with us.
Thank you.
Over the past weeks, you've been doing a lot less politics and a lot more of your quote-unquote day job. I know you've been working out of the emergency dispatch. It should be pointed out to our viewers, Alsace, the region that borders Germany, is one of the big clusters here in France. Originally, it was down in the southern part of Alsace in the city of Mulhouse, but you also have been feeling the brunt of it. We know that the curve is flattened. What's the situation like this Tuesday?
Well, the situation is a stabilization in the number of people tested positive to the COVID-19 and the stabilization of number of people being hospitalized, and maybe a little hope in people transferred in ICU, which is on 10% less than the other days. So we still have people going to the hospital. We still have people testing positive. We still have severe cases. By the number of people dying and the number of people going to the ICU is declining.
Siamak Agababaye, when you first saw the cases coming out of China, coming out of Italy, did you think Alsace would be hit so hard?
No, never. We had the same image at first, the image that we had from SARS or from MERS in the early 2000s, and we thought that we can have something about maybe 10 cases in Strasbourg. And then in something like a week, we saw people coming. We saw first elderly people and then younger people with very severe cases. And we saw people dying, and we saw people being transferred to ICU units, the need of ICU beds. And then we were really surprised, but no one of our colleagues were thinking that the pandemics were coming at this rate in our region.
Let me pick up with a question to Matan von Marschall, whose electoral district is just right across the Rhine River from that Alsace region that, as we have just heard, was hit very early and very hard by COVID. So, Mr. von Marschall, what has that meant for the people in your district and for your region as a whole?
That was and still is very difficult for our region. You should probably know that about 40,000 people from Alsace move to my home region, to Südbaden, to work basically. But they all work in very important places, like, for example, hospitals. So we absolutely need these people. And as a sudden, they couldn't come, but also because we decided to close the border, as Alsace was defined as a high-risk area. Why was it defined high-risk area? Because the infection spread exactly in that specific region, south of Colmar and direction to Mulhouse, because there was a church event with several thousand people, and these people, they were very close together, and so the virus spread very fast in that area. Now, just these days, we can come back to slightly open the borders again, which is very important for our common life. And I hope, and we will bring this topic into a meeting of the Committee of Cross-Border Cooperation, where I am member from the Deutsche Bundestag in this cross-border cooperation. This will be a video conference this Thursday, and I very much hope that we can convince both sides, Germany and France, to make our cross-border cooperation more easy in the near future.
Daniel Cohn-Bendit, Franco-German cooperation, well, that's literally in your DNA because you're a citizen of both countries. How do you think your two nations have risen to the challenge?
Difficult. It's difficult because for the French, it's difficult to see that it seems that it's easier to be in Germany and that they handle the COVID, or the COVID is not so explosive or less explosive than in France. And because this pandemic pushed national reaction. So if for safety, safety, it's a national thing. And so the cooperation is not good. It's not good, it's difficult, and I think that the French and the German government is not doing it well. It's not doing it well.
Still today?
Yeah, they did some wonderful things. There was, transfer from France to Germany, etc. Yes, but even now, even if you see the discussion that we have now for the post-pandemic, the economic recovery, I think that France and Germany are not on the same track. And if France and Germany is not on the same track, then it will be very difficult in Europe.
We want to come back to that question just a little bit later, but let me go now to Dr. Siamek Babai, because we just heard from Daniel Cohn-Bendit that, in fact, there are many people in France who have a sense that somehow the Germans are doing it better. We've seen some surprising headlines coming out of France. Les Allemands, pourquoi sont-ils meilleurs? Why are they better? Across the world, not only in Europe, but all over the world, it seems that the coronavirus is exposing the gaps and deficits in countries' health systems and in their economies. So what would you say you have seen about what needs to change in France?
Well, what I can say about the differences, first of all, maybe it is a difference on counting the dead people, because in France, all the dead people in this period also indirect that people are counted as COVID death. But in Germany, if you have diabetes or you have hypertension, you may be counted differently. When I said that, I can explain all the differences. Well, the other part of the difference is maybe about the number of beds per capita than you have in Germany. I think it's something about 8 beds for 1,000 inhabitants. In France, it's 5.9, and the number of ICU beds that you have in Germany, it's 2 or 3 times higher than in France. So that can explain, because when you have severe cases, it's your ability to have mechanical ventilation support to save people. And if you have more ICU beds and you have more ICU doctors and nurses well trained, then you can save people. So maybe one of the first lessons it's that we need efficient public health services in all the countries in European Union, around the world, and we need it urgently to face other pandemics coming.
But Siamak Agababai, the French spend more per capita on healthcare than the Germans. Why have they less to offer, as you've just described it?
Well, because we had a very accountant vision on health policy in the last 20 years. The last French government was really had a really austerity policy on health, and they closed something about 20,000 beds in 5 years. So at some moment you're gonna pay for this, because you need these beds for the people. And we in the emergency departments, we were saying that for something about 2 or 3 years, that we need beds, we need nurses, we need doctors, and we need budget spending on public health structures.
Let me say to Daniel Cohn-Bendit, I know you wanted to weigh in here. We want to just bring in a brief report, and then I'd like to come to you right after that. So even between close neighbors in the European Union, not only the effects of the virus, but also the responses to it have diverged pretty widely. The lockdown restrictions here in Germany, for example, were never as drastic as those in France, and in fact are now slowly being relaxed. My Deutsche Welle colleague, Michaela Küffner, has this short report from Berlin.
4 weeks into nationwide contact restrictions, the government is beginning to loosen its tight grip on public life. And German Chancellor Angela Merkel is cautioning Germans to be responsible with their regained freedoms.
We're now lifting some of these restrictions, but we don't know exactly what the consequences will be. And that's why we have to take this slowly, step by step. It would be a great shame if we now knowingly headed into a relapse.
At varying speeds, German federal states are allowing medium-sized shops to open, but hotels and restaurants have to remain closed. People on the streets of Berlin are torn between a sense of relief and concern.
Lifting the restrictions can go both ways. It really depends on how sensibly people behave now.
Life must go on. I'm not worried that people are going to drop dead around me. People just don't keep their distance. You cannot imagine how many walk past just 5 centimeters away from me.
Public backing for the restrictions imposed has so far been always upwards of 90%, and Angela Merkel's approval ratings have also soared. Germany's health system has so far been spared being pushed to the limit. Now the German Chancellor is concerned that Germans may over-celebrate the easing of restrictions, and it will take at least 2 weeks until she finds out.
So let me ask Danny Cohn-Bendit, do you share the Chancellor's concern about a premature relaxation of restrictions? I know that in a recent interview, you praised her leadership, for example, in comparison with the martial rhetoric of President Macron.
Yes, internally she is doing well. The problem is when she doesn't talk about Europe, and we can discuss this after. I just want to come back to the difference between France and Germany. I think the critics on the German health system, was exactly the same in the wording before Corona that it was in France. We shot beds, we shot hospitals, they didn't have enough nurses, etc., etc. The big difference is the federal system. The federal system is stronger. If it's good managed, and it is good managed in Germany, you have a health minister in every lender. It's why, even if they have less money, they are they organize it better of this decentralized level. And this is a big difference between France and Germany. And I think a part of the German society will be aware to continue to keep the 1.5, 2 meters. There will be, and a part of not. It's a problem, but at the end, you can't lock down for months and months the people. The family you can't do it. A family with 3 kids in a 60 meters apartment is impossible. You can do it 5 weeks, 6 weeks, and then it will explode. So also the French have to understand that we have to improve in distance, etc. But we have to open a little bit. If not, the people don't resist to go out without any restriction because it's too hard.
May I just ask Martin von Marschall to weigh in on this point? Are you concerned about premature relaxation of the restrictions?
Well, I feel that we, members of parliament, when we are in discussions with the people of our regions, of our constituencies, we are facing high pressure, especially from the business people, because they hadn't worked for the last weeks. I mean, we have programs to support them, but let's say those who sell goods in the cities, those who run restaurants, hotels, they are basically in a very difficult situation, and they urge us to do whatever we can do to relax these strict regulations. I think for the moment being, we are going a smooth way. We do it step by step. We ask our people to cooperate. We try to avoid, strict measures. Of course, if there is big parties, we must be strict. But we try to take the people with us and try to make them sensitive due to the fact that we will not overcome the crisis in a few weeks, but we will need to wait until we have medicament and vaccination. And this will take probably almost about a year. So we must, as Daniel Cohn-Bendit says, get used to a certain culture of distant behavior. I think we can manage this. We can manage it in supermarkets, but it's a hard way of, which also might be, if I may say so, different in Latin countries, in Mediterranean countries, and in no more northern countries, because we have different forms of, let's say, being close together. Of physical distance is different in cultures, in countries. I think we are in between. In southern Germany, we are somewhat more Latin, but let's in Hamburg. But I think there is a different culture which we might have in that respect in Europe.
All right, let's bring in Siamak Agababaei on this issue of the mindset of different nations. You can see Germany from your window, you can almost say, since after all, in Strasbourg, you have a tramway line that runs to Kehl on the German side. You heard Daniel Cohn-Bendit there, you heard Martin von Marschall. Is there a French mindset that makes it harder to observe the rules?
Well, I don't think so. Maybe I just can say before answering your question that maybe the first difference between France and Germany was the attitude facing this crisis. In Germany, they adopted a massive testing strategy and a more loose lockdown. In France, we have very not a massive testing strategies because tests were reserved for healthcare people and very severe cases. And now we have a general lockdown that may last something about 2 months, maybe more. Some people said, I agree with Daniel Cohn-Bendit that you can keep people this way. And there is no evidence today, apart from statistical models, than the general lockdown is better than a specific lockdown. So I think that we should, in all the countries, be able to have a massive testing strategy, so PCR or serologic tests, and then proceed by specified lockdown, maybe, and treat people you can treat. And at the end, I can say that I don't think there is a difference between France and Germany. I think what is different is the political discourse of the President Macron and what the German president say. I think we need to move from fear to trust. We should trust people. We should trust in their understanding, and they can understand and they can do better than what we think they can do.
Yeah, when Frank-Walter Steinmeier spoke 10 days back, he seemed to be almost taking a dig at Emmanuel Macron for employing martial language in his initial speeches. We're going to talk more about that in a moment. First off, northwest of where Siamak is, there is the Lorraine border town of Carling. And there, they've been keeping one essential service open. It's a report from France24.com's web desk by Sam Ball.
Ils n'osent plus venir, il y en a beaucoup moins qui viennent parce que ils ont des contrôles, ils ne peuvent plus passer par chez nous. Et avant, il y avait beaucoup d'Allemands qui venaient acheter le pain, et puis maintenant, vu les contrôles, alors ce qu'on peut faire maintenant, c'est que je rapporte le pain, je leur ai laissé mon numéro de téléphone, et puis ils m'appellent quand ils arrivent, et je leur rapporte le pain de l'autre côté de la barrière.
Also wir stehen hier an der deutsch-französischen Grenze zwischen Lauterbach und Karlinge und wir kaufen hier schon seit über zig Jahrzehnte in unserer lieben Bäckerei Brote und Croissants für unser tägliches Leben. Und jetzt dürfen wir zu Fuß nicht mehr rüber. Und als Zeichen der deutsch-französischen Freundschaft machen wir einen Online-Handel. So. Glücklich auf der deutschen Seite gelandet. Oh. Wirklich herzlichen Dank für diese deutsch-französische Geste.
So a great example there of how innovative people can become in a crisis, necessity being the mother of invention. But as you mentioned, Matan von Marschall, in fact, the border closures have caused a good deal of disruption, serious disruption. What would you say, looking at cross-border cooperation as a whole, how healthy is Franco-German solidarity in general?
Basically, I think we, France and Germany, always have different views on things. But as we discuss together, we can find a compromise. And if we reach a compromise, this often can be a model for the other member states of the European Union to follow. That is basically how I would like to describe our partnership. A very specific partnership, of course, is the one we are having between Alsace and southwestern Germany, specifically Baden, because we are almost the same culture historically. And therefore, I really am very sad about the fact that we have had the borders closed. And this can't go on. As I said in the beginning, we must open again these borders, of course, under maintaining strict standards of hygienic measures, that is quite clear. But we must meet again, because that is the reason why in Europe we build friendships. We have the Schengen area, all people can move, can get together. We have the students in the Erasmus program. Europe has built a community of common values, of democracies, and that is the reason why we can maintain that only if we come together, if we talk together. And if you have borders, you talk in a different way about your neighbor. You even might have prejudices, and you talk about people which sooner or later you will not know anymore. And that is what we have to avoid. And therefore, in our cross-border cooperation, I will fight for opening the borders again quite soon.
Dr. Siamakaga Babai, after spending the last few days at emergency dispatch in Strasbourg, are you in favor of reopening the border?
Well, I think we have soon or later we have to reopen the border, and but what we should do first is a massive testing strategy and finding the best way to do it. Is it serological tests? Do we trust all the serological tests? And some studies are being conducted in the Strasbourg University Hospital.
But you heard Martin van Marshall say that's going to take time. Are you saying in the interim keep the border shut?
Well, I think the border can reopen after the 11th of May, after the end of the general lockdown in France. I think it will be the day for the reopening, but not sooner, I think.
All right. In his recent interview with the Financial Times, Emmanuel Macron repeated what he said in a national broadcast here in France a week ago. That is that coming out of this crisis, humanity would be rethinking its priorities. And that includes, he says, the European Union.
Nous sommes à un moment de vérité qui consiste à savoir si l'Union européenne est un projet politique ou un projet de marché uniquement. Moi, je pense que c'est un projet politique. Quand c'est un projet politique, d'abord, l'humain est au premier chef. Il y a des notions de solidarité qui se jouent.
Si on n'y va pas, il y a un vrai risque de l'effondrement de la zone euro.
Oui, ben oui, il faut être clair. Et de l'Europe et de l'idée européenne. Je ne sais pas par quoi ça commencera, mais c'est évident. C'est évident.
So let me ask, first of all, Martin van Marshall, and then Daniel Cohn-Bendit, whether you agree with the French president and what that means quite concretely. Europe's moment of truth, more solidarity. Is Germany going to have to put a lot more money on the table to ensure EU recovery?
Well, I think we are about to do that. The Euro finance ministers have agreed on 3 points. First, to strengthen the European stability mechanism, so that countries that might have difficulties to get access to money, which could be true for, especially for Italy, would have easily access through the ESM. That is the first thing. Then the second, that is for companies, is a credit program from the European Investment Bank, which I think is very important for small, for medium-sized, for big companies. And then the third thing is the so-called SURE program. That is to support people that for the moment being have no work, but that could return to their original job. And in this meantime, need some support. In all these 3 programs, Germany is prepared to give guarantees. These guarantees sum up to quite a big amount of billions of euros. And I think that is a first step. The second step will be, of course, a recovery program, which we might include in the next multi-annual financial framework of the European Union. And of course, Germany, as biggest contributor in the European Union of net amount, because now the United Kingdom has left us, we are alone the biggest net payer there. will, of course, contribute in solidarity with those that are weaker. And I think these are important steps we are taking. But of course, we need to continue because it is also in the German interest that the complete Eurozone and that the European Union maintains stable.
That's where a lot of German exports go. Daniel Cohn-Bendit, noticeable by omission in that list that Martin von Marschall just gave us are, of course, joint European bonds to fund recovery. Isn't it time for Germany to give up its long-standing resistance to mutualization of debt, at least debt that will be incurred in future for recovery from this pandemic?
Well, when we heard Mr. Marshall, we see the problem. He said Germany is the biggest net payer. Germany is the biggest net winner of the European Union, not only the biggest net payer. And I think that all the debate now is you have to understand psychologically what it means for Italy and what it means for Spain or Portugal or Greece or even other countries. The problem is that the Italian they want to hear that for the recovery fund, Germany, Holland, Sweden, they are prepared to risk something for the recovery. And this is what I miss by Chancellor Merkel's speech. That he say, yes, of course, we will do solidarity, but we won't risk something. In a situation like this, to put in common a fund for recovery is that Germany will take with France, with Italy, with Spain, with the others, the risk of Mr. Dombrovskis, the commissioner, talks about 1.5 billion for the recovery. You can't do this only if all the countries we are ready to guarantee this fund for the recovery. And to say we guarantee, we say we share the risk. This is what the people in Italy, in Spain, and elsewhere they want to hear. The share of the risk of the recovery.
Sharing the risk, Martin von Marschall, we could change the name if you like. Will there be at the end some deal? I noticed, by the way, Emmanuel Macron in his interview with the Financial Times seemed to be hinting that, yeah, there's something in the works between France and Germany. Is Germany ready to take that risk that Daniel Cohn-Bendit talks about?
I must make very clear that we are taking big risks because these three programs, which I mentioned before, in the ESM, the European Investment Bank, and the SURE program for workers, mean that we guarantee more than 10 billion euros, which we are prepared to lose in the worst case. And all these three programs are not meant to support Germany, but are meant to support those who have big difficulties now. But what I was mentioning when I was talking about the future recovery plans, I think that we will be able to find a way that the European Commission, that is also true for the SURE program for the workers, can emit money. Of course, the member states, because the European Union has not a proper budget, but only the member states have proper national budgets, the member states must always guarantee there. And then the amount of guarantees and therefore also the volume of risk for Germany in the future will be a lot bigger. But let me point out one thing to the Euro bonds. I am absolutely convinced that even if we would have a majority in the German parliament, the Constitutional Court in Germany would not accept such a legislation because it exceeds, it goes over the responsibilities. We as parliamentarians for the national budget cannot do what in Europe is known as bailout. We cannot give the budget to Europe. It is our own national responsibility. And I'm quite I'm curious to see how our debates of these three programs, which I mentioned before, will be going on in the Bundestag. But I'm very sure that the Constitutional Court would not accept such a decision.
Let me bring in Daniel Cohn-Bendit. We're running short on time. Daniel Cohn-Bendit, the buck stops at Germany's Constitutional Court?
No, because it's completely wrong. You have two things. First, we have to increase the European budget by own incomes.
No.
You have the CO2 incomes. The CO2 own incomes means not that Germany pay more, that France pay more, that Italy pay more, but that there are own incomes of Europe. And this can be the CO2 tax, it can be the plastic tax, the digital tax, and this would be an enormous increase of the European budget. And with this type of increase, you can guarantee more for the recovery cup. And there, the German courts has nothing to say, because you have own resources. Export, import in Europe is an own resource. It doesn't go to the one of the other countries. So this is the first thing. The second thing is a recovery fund in this situation will be guaranteed by the European Central Bank. And if the European Central Bank guarantee, the European Court always backed the politics of the European Central Bank, even if the German Central Bank said it's not constitutional. So I'm not so afraid of the German. This is a trick. I'm sorry, okay. Mr. Marshall. It is a trick of the CDU not to discuss the thing.
With an eye on the time, let me cut that part of the discussion right there, because I'd like to bring in Dr. Siamak Babai now toward the end of the program to ask for your view, Dr. Babai, on how the EU can play a constructive role in recovery. You are sitting there in Strasbourg, in the city where the EU Parliament normally meets. In fact, it did not hold its last session in March. It is currently closed. And now the EU has offered to the city of Strasbourg to do COVID-19 testing at the facilities of the Parliament. Beyond that gesture, what do you think is needed from the EU?
Well, first I have to thank our German colleagues to have accepted transfers of patients in the ICU beds and permitting us continuing doing our job and saving people for the remaining ICU beds. So that was really a really great act, and I want to thank German people, German authorities, and German colleagues. What we need now, and when I heard the discussion between our two invitees, is that what can European Union do for European people? What we need to hear is that what Europe does mean to me. What can it change? How Europe can change our healthcare system, how Europe can change the situation of the people who have lost their job, entrepreneurs, how Europe can help people who are homeless. So how we can move from what was the vision of economic Europe, how can we move forward to a more integrated, maybe more federal, and maybe more political Europe, which in which the social part and the ecological questions will be, I think, what we most need in the next years.
The great citizens of Strasbourg are in our thoughts. Siamak Babai, there at the heart of it all, those first responders that you yourself work with every day. I want to thank you so much for joining us today. From the Alsatian capital. I want to thank as well Matern van Marshall for being with us from Berlin, Daniel Cohn-Bendit in Frankfurt. I'm François Picard for France 24 in Paris.
And I am Melinda Crane for Deutsche Welle in Berlin. And let me say thank you as well to all of our viewers for joining us on this premiere, this joint edition of the debate. We're glad you could be with us, and we hope to see you again soon. Bye-bye.